Hey guys, this presentation will be on generalized anxiety disorder, patient assessment and management. So, for example, this is a case you would get for a patient with generalized anxiety disorder. You have just seen a 33-year-old woman who attends with worries over her own health and the safety of her husband and children. She finds the worrying excessive and is not easy to control. Describe your approach and discuss the likely diagnosis and management with the patient. In terms of a differential, your provisional diagnosis for this patient will be a generalized anxiety disorder given the chronicity of her presenting problem. My differentials for an anxiety disorder can be divided into a primary anxiety disorder and a secondary anxiety disorder. So, primary anxiety disorders include panic disorders, social phobias, obsessive compulsive disease, and post traumatic stress disorder. Secondary anxiety disorder are secondary to other causes such as drug intoxication or withdrawal from caffeine, amphetamines, cocaine, alcohol, benzodiazepines, antidepressants, or penicillin, neurological causes such as epilepsy, brain tumors, multiple sclerosis, cardiovascular disease such as palpitations, and endocrine diseases such as hyperthyroidism and hypoglycemia. She may have generalized anxiety disorder coexisting with other psychiatric illnesses such as psychotic disorder, schizophrenia, or mood disorders such as depression and bipolar, and it's important to screen for these as well. In terms of generalized anxiety disorder, it has a 45% lifetime prevalence. Women are 2 times more likely to have it. The onset is less than 20 years of age. And often patients don't present just with the symptoms of generalized anxiety disorder, like I feel anxious. They mostly complain about abdominal pain or headache, other complaints that are a result of how much anxiety they're going through. Their anxiety is excessive, pervasive, it's uncontrollable, and they have a disproportionate amount of worry. It has to last for more than 6 months and has a significant impact on the patient's daily function and interpersonal relationships. The associated symptoms of generalized anxiety disorder is feeling restless, feeling on being on edge, easy fatigue, difficulty concentrating, mind going blank, irritability, muscle tension, sleep disturbance, difficulty falling or staying asleep, restless, unsatisfying sleep, autonomic manifestations such as palpitations, perspiration, dizziness, gastrointestinal disturbance, urinary urgency and frequency, and shortness of breath. In terms of a history, you want to focus on the symptoms of their generalized anxiety disorder according to the diagnostic criteria. Do a risk assessment because you have to do this for any psychiatric history, and assess for risk factors for generalized anxiety disorder. So, generalized anxiety symptoms include excessive worry on more than 6 months, difficult to control worrying, it has a gradual onset and a fluctuating cause, and 3 or more of the following: restlessness, fatigability, difficulty concentrating, muscle tension, and sleep disturbance. In terms of risk assessment, you want to assess the risk to self, to others, to their own reputation, and any suicidal ideation. Risk factors for generalized anxiety disorder is having a family history of psychiatric or mental illnesses, stress and trauma, being female, a past medical history of psychiatric disease, and also drug intake, but also how the illness affects their lives. On examination, you want to do a mental state examination, and once you finish your history and examination, you want to devise a formulation for the patient's disease, assessing the presence of the 4 Ps: predisposing, precipitating, perpetuating, and protective factors. In terms of investigations, you want to rule out secondary causes by doing a urine toxicology screen to look for any drugs that might be causing the anxiety, thyroid function test because hyperthyroidism can lead to anxiety, and an ECG for palpitations. Management requires multidisciplinary care using a biopsychosocial model and has 2 components: non-pharmacological, such as psychological interventions, and pharmacotherapy. Psychological interventions include cognitive behavioral therapy and modifying risk factors such as drug intake, sleep, and diet. Pharmacological therapy is indicated where the non-pharmacological treatments are inadequate. You need weeks before efficacy is present, usually 4 to 8 weeks. And the first line is SSRIs, second line SNRIs, third line TCAs like imipramine, and fourth line is pregabalin. You want to once the patient's been on this and they've been symptom free, you can try and stop the medications after 6 months whilst you're doing non-pharmacological treatment, which may have provided the skills for them to overcome their anxiety. If they currently are going through an acute severe disabling anxiety attack, give them benzodiazepines such as diazepam, 2 to 5 milligrams orally BD. So, about cognitive behavioral therapy. It uses an ABC model, which stands for Action, Beliefs, and Circumstance, Emotional Behavioral Model. It aims to dispel and challenge untrue beliefs for maladaptive thoughts regarding the threat of certain targets of worry in order to alter their anxiety response. The belief and circumstances in generalized anxiety disorder is overstimulation, catastrophization, problem solving ability, and low tolerance to uncertainty. It's done through a structured interview and a self reported questionnaire, reports on the somatic, cognitive, and behavioral symptoms of generalized anxiety disorder. In terms of pharmacological, the first line is SSRI, such as fluoxetine, Prozac, 20 milligrams up to 80 milligrams, or escitalopram, Lexapro. Second line is SNRI, such as venlafaxine, which is Effexor, and duloxetine, Cymbalta, and review in 4 to 6 weeks, adjusting their dose. The side effects of SSRIs and SNRIs include insomnia, headache, dizziness, sexual dysfunction, particularly in males, serotonin syndrome such as monoamine oxidase inhibitors, St. John wort, CNS stimulants, and the symptoms of serotonin syndrome can be divided into cognitive effects, autonomic, and somatic effects. Cognitive effect includes headache, insomnia, agitation. Autonomic effects include shivering, sweating, and increased heart rate. Somatic effects include muscle twitching and tremor. And again, just reinforcing, if they're undergoing a disabling anxiety, you want to calm them down with benzodiazepam, diazepam, 2 to 5 milligrams orally BD. Thank you. Yo.